I'm getting on to some questions from our followers and our
Yep.
trainers. And I have a pretty interesting question from Frederick, who asks, how would you treat a stiff ankle that causes trouble in the knee?
Stiff ankle. Okay. So first you got to figure out, is it the ankle joint, or is it the soft tissue around that area that's affecting the ankle mobility? So if I have a stiff ankle joint mobilization of that ankle will help improve the mobility of that ankle. So doing some self-mobilization techniques or manual work somebody can do for you. Sometimes if the problem's been there for a very long time, if you're having a hard time, you might have to have somebody get in there and work on that ankle.
Yeah.
The second part is, of course, if let's say if the calf or the Achilles tendon or any of the other soft tissue structures are so restricted and tight, whether it's the length of that tissue, as we were talking about a minute ago, or it's the myofascial restriction, or the tissue glide is not there. Or you got, again, you got adhesions that have formed. You had an old injury, and now you have adhesions that have formed, and the tissue just doesn't move, and it's tender possibly. So that you got to get in there. One, you might have to do stretching techniques or myofascial release techniques, or you might have to get in there with your hands and do massage and break up that scar tissue to get that tissue moving again.
Yeah.
So that will free up. Now, if Frederick wants to make sure that ankle is there, so he would do both things to make sure that the ankle joint is moving, as well as making sure that all the tissue, soft tissue, is moving too.
Okay.
And that will, at least he'll relieve some of the load. If the ankle stiffness is causing pressure on his knee, that'll take away some of that stuff for him.